Hi there, I'm Ted Levitt. I'm a registered clinical counselor. I work in private practice in Abbotsford, British Columbia, Canada. I specialize in aggressive behavior, addictive behavior, anxiety, and ADHD, and basically all forms of impulse control problems. Today I want to speak to you about ADHD, and this is the first in a series of videos about the diagnostic criteria for attention deficit hyperactivity disorder. I'm making this series of videos because ADHD is a very misunderstood condition. It is often maligned in the media and made out to be something different than what it is. Even within the world of mental health and mental health treatment, it is misunderstood. Often when you go to a doctor to talk about ADHD, they don't know anything more about it than you do as the patient, and in some cases less. When we're talking about ADHD, or ADD as it is also known, we're talking about a condition that's defined by symptoms of inattention or difficulty paying attention, impulsive kind of behavior, and or hyperactive behavior, although the hyperactive component does not have to be there in order for ADD to be diagnosed. I think it's important to remember when we're talking about ADHD that it's not easily categorical. And what I mean by that is in psychiatry and mental health, in order to be diagnosed with a disorder, we have to say there are X number of symptoms, and if you have a certain number of those symptoms, then you meet the diagnostic cutoff basically for that disorder, but that's not very real world in terms of its application. If you have to have 6 out of the 9 symptoms in order to be diagnosed, but you only have 5, are we then to conclude that you don't have a problem or you don't have an issue there? Because really, what's the difference between someone who has 5 and someone who has 6? So as I talk about these various symptoms and signs of ADHD, I think it's important to keep that in mind, that we're not talking about do you do this or not do this, it's about how much do you do this. Another common criticism of ADHD when you hear about the signs or symptoms of it is, well, everybody does that, everybody thinks that way, everybody feels that way. And it's true that everybody, when we go over these signs and symptoms, everybody will be able to identify to some degree with all of them. But what I'll often say is if you present some of these things some of the time, then you're human. If you present most of them most of the time, then you're still human, but there's something else that's sort of qualitatively different about your experience. So don't be too quick to dismiss what we're talking about based on the idea that, well, everybody's like that. And related to that, I think it's important to recognize that just because everyone that you know is like that doesn't mean that everyone is like that. ADHD tends to run in families and social circles. It would be common for people with ADHD to look at any of the signs or symptoms and say, well, that's normal, everybody's like that. And it may be normal in their slice of the world, but we know that with both children and adults, the ADHD symptoms are really only experienced at a clinical level in about 10% of the population. Looking around you and saying, well, everyone's like that, isn't necessarily a great indicator as to whether there's an issue or not. Also, in terms of a diagnosis for ADHD or any other disorder, one of the qualifications is that the symptoms of whatever the condition are need to be causing disorder or significant impairment. So really, we're not looking at how many of the symptoms does a person have, we're looking at what kind of impact do those symptoms make. So if I'm an artist and I'm creative and I work for myself and I don't really have deadlines and I have total control over my schedule and my life, ADHD isn't really a disorder because it doesn't cause disorder. In many cases, it may actually enhance what I do. But if I have a job where I have to sit at a desk and stare at the computer screen and make the paperwork, get in on time and things like that, it would be causing disorder and causing impairment, or what we call functional impairment, in my life. So again, it's not just a matter of, oh wow, I have all those symptoms, I must have a disorder. We have to look at the end of, okay, you have some symptoms, do they cause disorder? If not, then you don't really need to worry about it. To that end, it's important, I believe, to think of ADHD not as a disease or an illness, but as a particular type of brain that's better suited for some environments and situations than it is for others. If I was an explorer and I needed to sort of set out every day not knowing what was over the next rise and get on a ship and sail across the world, having ADHD might actually be a benefit to me. If I am an accountant, as I said before, or I have to be very meticulous and detailed in filing reports and things like that, then it's obviously not going to work for me. But we wouldn't say that people whose brains don't work like accountants have a disease. On the surface, it just sounds ludicrous to say that, but in many ways, that's kind of how our society thinks, that if you're a non-linear thinker who struggles to finish what you start, there's something wrong with you, instead of just saying, well, maybe you're an ideas person and not a details person. So I think that's an important way to frame this discussion of ADHD. The final thing that I would say about ADHD before I get going is that it's not just a list of behaviors. All of those behaviors and feelings and subjective experiences have an emotional impact on the person's life and the people around them. I have ADHD, but I was not diagnosed until I was an adult, and by then many of the emotional prices that I had paid were well wired into my brain. Feelings of inadequacy and inevitable failure and what we call learned helplessness, they were already well wired into me. And those aren't the kind of things that are necessarily included in the diagnostic criteria. And so I think, again, that comes back to the functional impairment side of things, where maybe I get the job done and I am able to cope and handle the symptoms or handle that type of brain, but at what cost? Am I constantly feeling like I'm less than other people, and why is my life so much more difficult than it needs to be, and things like that. And I don't think that that's adequately captured in just the classic criteria. So I hope you get something out of this series. Feel free to make comments below. Try and keep them respectful. I know that ADHD inspires a lot of debate amongst people, both educated debate, but usually uneducated debate about whether it's a disease and whether we just want to medicate children and make them be quiet. That's kind of irrelevant to what we're going to be talking about today. So, like I said, I hope you enjoy it. Feel free to make comments and subscribe if you want to.